Ron Cook, and Lubbock Mayor Dan Pope. So let's get started with Catherine Wells.
Thank you, Lacey, and good morning, everybody. Today I want to talk briefly about our COVID numbers and also continue to talk about those very important vaccination efforts. Last week, we averaged less than 10 cases. It's been a long time since I've been able to say that. Our hospitals really look good with only a handful of COVID patients between both UMC and Covenant. However, with that said, we are still in a race to get people vaccinated. Many cities in Texas are starting to see an uptick in cases, and we need to keep getting people vaccinated before we see any uptick in cases here locally. Vaccines mean that you can travel, you can visit those loved ones that are at high risk, you can get back and enjoy all of the things that we used to do without worrying, without that nagging feeling that you might be able to transmit that virus. We have been offering vaccine now for nearly 4 months. We are close to halfway there, but the number of people seeking vaccine has dropped. We were vaccinating over 10,000 people providing 10,000 vaccines per week at the Civic Center and our community partners such as United Pharmacies, clinics, and doctors' offices. However, last week we saw a big drop in the number of vaccines, and we only saw about 5,000 vaccines given in Lubbock. I know this was in part to the J&J vaccine being put on hold. However, we have enough Pfizer and Moderna on our shelves here locally to get everybody who wants to get vaccinated vaccine. There are appointments available, and if you need help finding vaccine or a vaccine appointment, call your local pharmacy or feel free to call the health department at 806-775-2933, and staff will be more than happy to help you get an appointment at either the Civic Center or one of our community partners. Over the next few weeks, the health department will be shifting our vaccine efforts. We will be moving away from our mass vaccination clinic to smaller pop-up events. We did our first event last week at the Texas Tech baseball game, and it was a lot of fun, but staff will be out at festivals, hosting some clinics at the mall, and smaller clinics around town. If you haven't been vaccinated yet, please come find us at one of these events. Next week will be our last full week of vaccine clinic at the Civic Center. We need everyone who got their first dose at the Civic Center to come on out and get your second one. If you need that second dose, just show up at the Civic Center. No appointment is needed as long as it's during those clinic times. It's safe, it's effective, and we will get you in and out of the door within 30 minutes if you come in for that second dose. So please, I encourage everybody who needs that second dose to come on out and get that vaccine. With that, I will pass it over to Dr. Cook.
Thank you, Catherine. And I know that most people have heard that the Johnson & Johnson vaccine has been paused. Let me just say that this is a good thing because it means the safety systems that were created with these new drugs, these experimental drugs, that they are working. All these stopgaps to make sure this is a safe drug are working. So it's our goal to stop this virus, but it's also our goal not to injure others in doing so. So these pauses have automatically built in. When they presented their drugs to the FDA, they said, well, what are you going to do if something happens? And so we have this reporting system. It's called a vaccine adverse event reporting system. And this is how these number of cases came about. And they said, oh, we should probably stop and take a break and make sure that this is not really related or related to the drug. And that's the studies and the information they're looking over right now. The same thing happened in Europe. And just 2 days ago, after their studies and review of the material, they said, it's okay to use. We want people to know about this potential for blood clots. And so they've sent out information about that. And so, but they have released it back so they can use it in Europe. I believe that we'll see the same thing come Friday. We'll wait for the CDC and the FDA to make that announcement on Friday, but I feel sure that they'll probably say it's okay to use. Now, these blood clots that occur, these symptoms that occur, it's only happened in 7 cases in 7.5 million doses. That's less than 1 case per million doses given. And in Lubbock, we've given about 2,300 doses of the Johnson & Johnson vaccine. I think we're pretty safe, although I'll go over some specifics about what we need to look for in just a minute. So for these cases, these 7 cases have all been women between the ages of 18 and 48, and all within 2 weeks of receiving the Johnson & Johnson vaccine that they developed these blood clots. And so it's very rare. It does happen. In fact, actually giving a vaccine or giving a drug that causes blood clots is not unusual. We've seen this before for example, you may have heard, we don't want you to use heparin. Heparin is a blood thinning drug that we use so the clot doesn't get any bigger. However, in this particular case, because we think that it's part of our immune system that's causing this, we don't want to use heparin because heparin is also known to cause that too. We have other drugs that we can use to stop the growth of the blood clot. And so we don't want to use heparin. We have lots of other drugs that we can use in that particular case. For those of you that have received your vaccine more than 3 weeks ago, your Johnson & Johnson vaccine more than 3 weeks ago, the odds of you getting this are extremely low. Remember, this only happened in individuals within 13 days of receiving the vaccine, the Johnson & Johnson vaccine. So if you're 3 weeks from that, you're okay. Within the last 3 weeks, let's keep an eye on the following symptoms. And so what are the symptoms of a blood clot? It could be shortness of breath. You have a hard time catching your deep breath. You may have some chest pain. If the blood clot is in your leg, it may cause some swelling in that leg. If it's in your abdomen, like blocking the veins to or away from your intestines, you might have some abdominal pain. So those are signs we need to take care or pay attention to for blood clots. If the blood clot is in your brain, and some of these were associated with a clot in the brain, you might have a very severe headache. You might have some blurry vision. You might have some weakness on one side. So pay attention to that. You might also pay attention, so it's not only blood clots, but low platelet count. And platelets are those little factors in your bloodstream that help build the clot or start the clotting cascade to build a clot. In this particular case, we see low levels of platelets. So you might have easy bruising, unusual bleeding, red spots or little blood spots on your skin, or that's not really associated with where you got your vaccine, but we call those petechiae. And so if you see easy bruising or bleeding, if you see any of these signs, any of those signs I just went over, please talk to your primary care provider immediately. Okay, and if it's been less than 3 weeks since you received the Johnson & Johnson vaccine. Here's our goal. Our goal is to get everybody vaccinated. I know people feel less urgency about getting vaccinated. We see a low number of people that are in our community that are getting sick. Our hospital numbers are better. Our ICU numbers are better. And for the most part, that's because we have so many people that have been vaccinated. Some of you have not been vaccinated, and the virus is still present in our community. Even mutated virus is present in our community. We know that the California variant, the African variant, and the UK variant are in our community. They're more infectious. They may not cause more severe disease, but they're more infectious and you could give it to somebody else. And as long as that virus is in our community, it's replicating. And anytime it's replicating, it can be mutating. And the only way for us to stop mutation of the virus is to stop the replication. And the way that we stop replication is by vaccination. So please get your vaccine. As Catherine said, we have plenty of the Moderna and plenty of the Pfizer vaccine available. I do believe that we'll have more Johnson & Johnson by the end of next week or the following week when it's released again. And so please take every opportunity to get your vaccine. If you have received Moderna or the Pfizer vaccine and you need your second dose, please come get that. You're not as well protected. To get to 90 to 95% protection, you must have that second dose of those two vaccines. And by the way, Moderna and Pfizer have not been associated with that clotting disorder or the production of clots. So that's good news. Strongly encourage you to get vaccinated. It's our goal to keep our community safe. Thanks for getting your vaccine and doing all your good work. Let me hand this off to Mayor Pope.
Thank you, Dr. Cook. I remain thankful for your efforts and those of Ms. Wells. I want to start today by sharing our data slides. So I'm going to share my screen real quick. Okay, so our hospitalization rate remains very, very low, just above 2%, where it's been now for the last month or so. Our case counts, Ms. Wells talked about the number of cases. The distribution is very familiar looking. It's nothing remarkable about this. It's what we would expect. And finally, I want to spend a little bit more time looking at our vaccine doses administered. A note here, remember that the blue doses, the blue that represents both for all first doses, including a J&J, which would be just one dose would be reflected there. You can see that yesterday, most of our effort at the Civic Center was second doses. We still have first doses available, as Ms. Wells said. Please, let's get our vaccines. I'm going to come back to vaccines in just a minute with some data, but I will stop sharing my screen. And I think I'm back here now. Okay. I want to, as is my practice, I want to start by thanking you for taking this seriously and for sharing my thoughts, my sympathies, and expressing empathy to those of you that have been impacted by COVID-19, lost loved ones, whose businesses have been impacted. I had a chance to visit a large employer this week and had a conversation with the general manager, and he has a really compelling story about the impact COVID has made on his life. And that's just a good reminder. I also saw that Ted Nugent, the rock and roller who people of my age would remember well, who's been a bit of a conspiracy theorist, indicated earlier this week that he's dealt with a very difficult case of COVID. I guess it strikes everyone. We've got to restart our vaccine efforts. We led the way for so long. We're now lagging. There's good news. 75% of our 65 and older population are fully vaccinated. That's good. About 42% of our population over the age of 16 has received at least one dose. Now that could be fully vaccinated if they've got the J&J. We've got to do better there. We need to grow that number. We led the way in West Texas for so long, and we still lead the way in West Texas, but we're lagging other parts of the state. Vaccine is safe, it's effective. Dr. Cook and Ms. Wells have just talked about that. We're going to bring the vaccine to you after next week when we close the mass vaccination clinic down. But please don't procrastinate. Let's get your shot. The best shot is one that's in someone's arm. Finally, our press conferences our cadence will change. There won't be a regular cadence. You will hear from us again, likely the week before Memorial Day. We'll come back if there are reasons to come back with a press conference, but you shouldn't expect us to be with you every other week. I believe that takes care of my comments. Lacey, I'll send it back over to you.
Thank you, Mayor. I'm going to ask all the panelists to start their videos. We're going to open it up for some media questions now. And our order today is the Lubbock Avalanche Journal, Latino Lubbock, El Editor, KLBK, KCBD, the Daily Toreador, and KMAX. Let's get started with Matt Dotre with the Avalanche Journal.
Good morning, everyone. Ms. Wells, can you just talk a bit about how, I guess, the pause in the Johnson & Johnson vaccine, kind of how that disrupted your vaccination effort? Did you have to cancel any targeted clinics?
We were actually able to offer Moderna vaccine to anyone who had scheduled an appointment with the Civic Center or with the health department when we had that pause. We were expecting or wanting to give out a lot of Johnson & Johnson this week and next week while we still have the Civic Center set up. So it's, hampered those efforts.
Mm-hmm. How many doses? Are you still sitting on 5,000 doses?
We have about 7,000 doses of Johnson & Johnson in stock. And if they remove that pause, we will begin distributing that quickly.
Okay, very good. That's it for me. Thank you.
Thank you, Matt. Now we move on to Latino Lubbock with Christy Martinez Garcia.
Good morning, afternoon, everybody. Great to see you all. I went on a vacation, came back, and I am really happy to see the numbers low. So that's great news for our city. But I did want to ask, what groups, are there any specific populations that you're having a hard time reaching to get vaccinated, and why do you think that is?
Catherine, you want to talk about that?
Yeah, I think it's really scattered of who we're not reaching. We've seen, a really strong lots of demand up until about 3 weeks ago, and lots of people coming to the Civic Center, and we had more vaccine, or we didn't have enough vaccine to fill the need. And now we've definitely seen that change. And I think it's a range of different groups of individuals that, aren't as, don't feel the need to come and get vaccinated right away, or feel like they want to wait a little while. And we really just want to encourage everybody, now's the time to get vaccinated. Even with our case numbers down, some people don't see that urgency, but we need to get everybody vaccinated before we see variants, before we see increases in cases.
The only thing I would add to that is, Christy, just sort of empirically, 2 weeks ago when we had the J&J United filled up their special Thursday clinic at United Spirit Arena focused on college students. Last week when we shifted over to the Moderna, we had very little demand. So I think we will see some of our populations more likely to get the J&J vaccine once it's deemed effective and ready to be distributed.
My next question is, speaking of college students, I think there's still a little bit confusion with them as far as, do they get the vaccine knowing that they're going to be leaving, some graduating? How should they handle that? Or should they wait to when they arrive back home in their own communities and get the first and second doses there?
Great question. Dr. Cook, or Catherine, why don't you start and let Dr. Cook finish on that?
They can start that vaccination series here while they're in Lubbock. All vaccine providers are told that they give a second dose regardless of where they got the first. So if they want to start that first here and they go back to Austin or Dallas, they will find a provider that will give them that vaccine. Just make sure it's the same brand.
I know that Dr. Skovanec and Dr. Rice-Spearman has encouraged all the students at Texas Tech and the same at all of our universities, Wayland and Lubbock Christian and everybody else. They're all strongly encouraging their students to become vaccinated.
Great. Thank you for the information. Mayor, did you have something you wanted to add?
I forgot to mention something a minute ago. Thanks for the prompt, Christy. We also, we want to let our media partners know that we will continue reporting new cases as we have through this week. Next week, we will not report new cases. And then that following Monday, which will be the first Monday in May, You'll start to see a weekly report from us that will detail new cases by day. Now, if you want to go to our website, we'll still update it every weekday, as we've been doing, but we'll only provide a press release with the information once a week. And if something were to change, we certainly could reinstitute the cadence we've been using, but we feel like that's appropriate right now. I want to make sure I mention that.
Well, better days ahead that is, and I appreciate your time.
Thank you, Christy.
Thank you, Christy. And now move on to El Editor with Olga Guerrero.
Good morning, y'all.
Morning.
Buenos dias. Glad to see everybody. My question is, if Dr. Cook already answered, as for the blood clot signs, as for the J&J and the number of vaccines given. So some of my questions have been answered, which I appreciate very much. But I have in mind something like, if people deny to receive the J&J vaccine and want either the Moderna or the Pfizer, will that request be honored or not, and why?
So what, make sure I understand your question. If they don't want the J&J vaccine, can they get the other two that are available here in Lubbock? If that's the question, absolutely. We have plenty of those doses.
Very good. So that would encourage people to not be hesitant because of what's.
Yes, please come get your vaccine. We got to stop the virus.
Yes, sir. Understand correctly. Will you be out at the Cinco de Mayo event? And maybe another suggestion as for being out on different events or different areas, I would maybe recommend, I don't know what the possibility is, but to maybe go to the flea markets.
Olga, I've not heard the flea market idea. Love it. We will definitely look into that. We do have plans to be at Cinco de Mayo.
Thank you very much. I wish y'all the best all the time, and may God bless you for your efforts. Thank you.
Thank you. Thank you.
Olga. Now we move on to Matthew Stell with KLBK.
Thank you very much, Lacey. Good morning, everybody. One quick question. We hear Moderna is saying that they may require a third booster shot for the 2-dose vaccine they've already put out. If this is the case, and this is for anybody to answer, is there a possibility that we'll have a smaller clinic at the Civic Center or start seeing any of those pop up around town if there is a booster shot needed for Moderna?
I think, Matt, I've seen the same press. It's a bit of a hypothetical at the moment. We certainly will respond to that as needed. As you know, Matthew, we do flu shots on an annual basis already. We do that both at our clinic as well as through partners. And I would imagine we would address it like that in the fall if that in fact becomes a reality.
That's all I got. Thank you.
Thank you.
Thank you, Matthew. And now we go to Karen McKay with KCBD.
Hello, everybody. I'm sorry, my voice is leaving me. I hope you can hear me. When you consider the natural immunity from people who've had the infections and combine that with, as you said earlier, 75% of the population, the high-risk population over 65 are fully vaccinated here, not to mention all those who've had a first vaccine. Haven't we reached herd immunity yet, or aren't we at least very, very close?
Karen, that's, the most difficult variable to determine is who's had it and never been tested for the virus. And so there's probably a significant number. You're correct. There's probably a significant number out there, but we can't base our definition of herd immunity on subjective information because we don't have any way to know. The only hard data that we have are those that have either been tested, who have actually had the COVID virus, and who has been vaccinated. So there is a significant number, I believe, that are probably out there that may have antibodies against it because they were exposed and may or may not have any symptoms of the disease that we can account for. but it's certainly adding to it. We just don't know how big that number is.
And if I
Right.
can add to that, there's a lot of new data that's coming out that's showing that those who have been infected with COVID, there is still significant benefits to them being vaccinated, and it's going to help with the possibility of these variants coming in, and they'll actually be more protected with the combination of having COVID plus the vaccine.
All right. And also, Catherine, early on we used to track the locations of the virus. Well, now that we're back to those low numbers that we saw in the very beginning, is there still an interest in tracing this? And, where are, even though there are fewer than 10 cases, what are you learning? Where are they happening? Where is the virus and how is it spreading right now?
We are able to really refocus our contact tracing efforts now with the smaller number of cases. We're seeing everything from a child in elementary school to someone that's been just at work. Very few breakthrough cases of people that have been vaccinated. Really just there's still community spread, there's still risk out there, and that's why it's important that we continue with the masking efforts for a little bit while longer, and that's why it's so important that we get everybody vaccinated.
Okay, thank you very much.
I want to tag on that real quick and just ask for a little more help from our media partners. We talked about large events and large employers, churches. If people reach out to you, send them to us. We want to take this vaccine ability to where the people are, where people want it, and don't in any way think that we're closing up shop just because we're closing the convention center at the end of next week.
All right, thank you.
Thanks, Karen.
Thank you, Karen. And now with the Daily Toreador, we have Bao Pham.
Good afternoon, everyone. So my first question is, so there was a statement made by the CEO of Pfizer last week that people might potentially need a booster shot every year to prevent themselves from the variants of the virus. So Moderna also have plans to release a booster shot sometime later on. So given the situation that people are still probably need extra booster shot to be fully protected against the variant, so is it still safe for people after the 2 doses to continue traveling?
For now, yes, Bao. And the booster shot is probably more directed at the variants and modification of the current vaccine to cover those variants. Right now, we have pretty good coverage, even though the UK variant and the African variant and the California variant are here. But as that virus continues to mutate, we'll probably need better coverage. So we'll see. And I know that probably all the vaccine companies are working on predictions of what their vaccine might cover with the current trends in the variants, just as they do with the flu virus. And so right now, my assumption is probably 50-50 that we'll probably need a booster shot come the fall.
Okay, so since the vaccine clinic will be, I believe that it will be no longer concentrated at the Civic Center after May start. So could there be a notice from the city on where smaller clinics, vaccine clinics will pop up, or will it be randomly available?
We'll make those announcements of where we'll be through our media partners, Facebook posts, other social media. We want to keep that vaccine message out and let you know where you can come to either get a first or second dose. Make sure that everybody has that opportunity to be vaccinated.
In the same breath, we would remind everyone that the vaccine's widely available in our pharmacies around town, and it's free. And don't forget that that's a great place to get your shot. Many of your physicians' offices have it now also. So there are a number of places to get a vaccine.
Thank you very much and stay safe.
Thanks, Val.
You too, Bao.
Okay, now we go to Katie Gray with KMAC. Katie, can you unmute?
Hi, Can you hear me?
Hi, yes.
Excellent. Thank you so much. I really appreciate all of your time. So my question is regarding the vaccination clinics. So our vaccination clinics have gone remarkably well in comparison to other Texas cities. So my question is, what do you attribute that to, and why was Lubbock so much more successful than other cities?
Well, I mean, I think it's pretty simple. We're just a lot better than they are. No, seriously, we've talked about it a lot. We've got a great team. Ms. Wells and Dr. Cook lead a great team. Our public health department's done a wonderful job. The hospitals have been fantastic. We couldn't have done it without Texas Tech, particularly the medical school students and the nursing school students. We've gotten great support from our physicians and nurses and retired nurses in the community. And we've had a lot of volunteers, churches, civic groups. It's a little bit trite to say it, but it takes a village. And I think that's what we've done. I think I miss Lubbock Fire and Rescue. They've been right there step for step with us. And you guys have been great partners in the media telling the story. And so together, I think we've been successful.
Okay, so my only follow-up question would be, was there also learnings from, especially everything that has happened, if there was anything that would definitely be something that might be approached later on differently?
I think we've learned something every day. Catherine and Chief Fogerson and their teams made changes in the way we queued people and, routed people through the Civic Center. We've learned a lot about communications. Lacey and her team have been very effective in how we reach out to different parts of our population. I think the ambassador program has been effective in reaching different segments of our community that maybe we don't have as much success reaching. But yeah, we've learned and we've continued to learn. And one thing we know now is that we still have people that need the vaccine. So we're going to remain vigilant and relatively, we're going to be assertive, maybe getting close to aggressive on continuing to try to provide opportunities for Lubbockites, for West Texans to get the vaccine.
Well, thank you very much.
Thank you, Katie. Nice
Katie.
picture there too on your welcome page.
Glad to have you with us, Katie. This concludes our news conference this week. Remember, our next one will be in a few weeks before Memorial Day. We thank you for joining us. Thank our panelists and our interpreter. Hope you have a good rest of the week and stay safe.
Bye.